Joining us now is Schaumburg's Congressman Raja Krishnamoorthi. And why are you concerned about the wellness of doctors, nurses, and other medical personnel here at the height of COVID?
Well, it's a personal issue for me, and I know that your wife is a registered nurse. My wife happens to be a physician, and like her colleagues, her fellow healthcare workers, she's worked tirelessly during this pandemic doing COVID procedures. And, you know, we oftentimes refer to these healthcare workers as heroes, Mike, but as you know, they're also humans. And as humans, they've suffered from depression, they've suffered burnout, and they've even suffered suicide. And
in fact,
so,
you've named this proposed act, this proposed new law is named after a doctor who did kill herself.
That's right. She happened to be an emergency room physician, and like many physicians, they were exposed not only to the trauma of their patients dying on such a regular basis, but also exposing themselves to and their families to the increased risk of COVID. And what we found is that these healthcare heroes needed mental health resources that weren't there for them. And so what my bill does is it establishes mental health programs at hospitals, at medical schools, at all the places where these healthcare workers train and then practice, so that they can have access to them when they need them. You know, just in our area, I had a roundtable discussion at St. Alexius Hospital in Hoffman Estates, and what they did, Mike, is they basically have these mental health folks actually fan out into the hospital where the doctors and nurses work to do wellness checks during their shifts, as opposed to kind of waiting in an office down a corridor where, you know, quite frankly, these doctors and nurses don't have time to visit.
You also want to provide billions of doses of vaccine to places around the world that currently don't have much of it. What are you thinking there? I know there are some people who have said, America first. Let's not, until we've all gotten it, let's not give any away.
Well, I think that we're kind of at the point where the shortage of vaccines is not really the issue that we're confronting in the United States. It's more vaccine hesitancy and vaccine resistance, preventing the entire population from being vaccinated. But what we're seeing abroad, Mike, is a shortage of vaccine. So, for instance, in Africa, less than 11% of the continent of 1 billion people have actually received their first dose of vaccine. And even in South Africa, you know, only about 30% of the population has received their first dose of vaccine. And so what I've said is that COVID anywhere is a threat to everyone everywhere. So not only is it the right thing to do, but it's the smart thing to do to prevent the emergence of new variants.
Because the more people who don't have the vaccine, who get ill, that they become hosts, so to speak, for possible mutations of the COVID virus.
That's right. There's a petri dish effect that's created when, you know, so many people are unvaccinated. You know, back in the May timeframe, unfortunately, 3 of my extended family died of COVID in India due to the Delta variant. And that's what led me to introduce the NOVID legislation, which is a play on words, no more COVID. And the idea is, how do we help to vaccinate the majority of people in the poorest countries so that we can really do what we did in Africa with HIV/AIDS under George W. Bush and the PEPFAR program, which has done wonders in saving tens of millions of lives and preventing the spread of HIV/AIDS in the continent and worldwide.
Well, first of all, I did not realize you had lost 3 members of your family, and my condolences on that. And if I'm recalling correctly, your family's roots are in the same part of India as Vice President Harris's maternal side of her family, their roots in that same, is it Chennai in India?
That's right. That's right. In the south. You know, this what we saw with Delta variant, Mike, is that it struck all levels of society. It didn't matter who you were. If you were not vaccinated, you were a prime target. And that's just why I believe so passionately in this cause of getting, especially underserved people throughout the world, vaccinated ASAP.
Congressman Raja Krishnamoorthi from Schaumburg, thanks very much for joining us. I hope you have a happy holiday, you and your family. We'll be right back after a quick break.